I'd like to thank you to this World Parks Academy webinar training series, the topic Tobacco-Free Playground Initiative in Millennium Park in Dublin. This is a presentation by Kevin Halpenny, who is the Senior Parks Superintendent in Fingal County in Dublin, Ireland. And I'll turn it over now to Kevin.
Hi everybody, welcome to my presentation today, which I hope you'll find informative and perhaps useful in your work. It'll take me about 45 minutes to work through the slides, so I hope you find it interesting. Tobacco is widely regarded as the single most preventable cause of death in the world today. And smoking policies are important in protecting people from secondhand smoke and also in denormalizing smoking. This denormalization helps prevent young people starting to smoke and encourages others to stop. You'll hear me talking a fair bit about denormalizing smoking in the course of my presentation. Wow. I don't think I'm driving yet. So, I work in Fingal, and Fingal County Council, where I work, was established in 1994 and is the local authority for the administrative county of Fingal, which is located north of Dublin City. It's bordered to the south by South Dublin, to the west by Meath and Kildare, and to the east by the Irish Sea. And it covers an area of about 450 square kilometres. It has a population of 276,000 souls and making it the third most populous local authority in the Irish Republic. The population increased by over 63% between 1996 and 2011, and it is also the youngest population by age in the country. It has significant economic advantages. It is a transport hub with the national airport, fast access through our Dublin port, rail, road, power and communications infrastructure, and its proximity to Dublin city centre makes it a good place to live. It's also located on the Dublin-Belfast economic corridor. It's defined by the diversity of its landscape. It is rural and urban and suburban, and it is home to established communities who trace their roots back hundreds of years, as well as very new communities from outside the country, and has the largest non-Irish born population in Ireland. We manage 2,000 hectares of public open space, and many of our parks are located in large heritage landscapes dating from the 17th, 18th and 19th century. So this smoking initiative, the Smoke-Free Playground Initiative, is an example of smart promotion, i.e. using research findings to support a hypothesis and to encourage a positive change in behaviour. In this case, it is aimed at changing behaviour which promotes a public health objective of reducing levels of smoking in the population, and in particular the denormalization of tobacco smoking in an environment that is defined exclusively for the use of children, i.e. children's public playgrounds. The initiative is an example of a multidisciplinary, cross-sectoral, collaborative approach. In this particular case, it brought together practitioners working in public health research, public health services directly delivering services, local government management and local government policy making. The combination of different knowledge, skill sets, and access to different types of information and means of effecting change is at the heart of this approach to improving public health. So this, as I say, cross-disciplinary, cross-sectoral approach is key to, we feel, success of public health initiatives in relation to parks and other public areas. So the Tobacco-Free Playground Initiative group was established in early 2010 with representatives from, from the Health Services Executive, which runs the health service, hospitals, etc., in the Dublin North East Health Promotion Unit, and also Fingal County Council Parks Division, along with a non-government governmental organisation called the Tobacco Free Research Institute of Ireland. And this is a not-for-profit organisation. It carries out research into the effects of tobacco smoke and advises state agencies on current research in the area of tobacco control. So you might ask, why do we need a smoke-free playground policy? What's the evidence supporting this need? Looking ahead, one. Can you go back one, please? To gain public support for the initiative and ultimately, one forward, that's it. Gain public support for the initiative and ultimately the adoption of a policy, it is important to have clear and unambiguous evidence in support of the need for the policy. So we had to be able to show that there was a rationale and indeed that there would be support for such an initiative in the general public. Otherwise, we wouldn't get it through the policy procedures for adopting policies. Just go on. So just some of the stats on smoking in Ireland. Over 1 in 5 Irish people smoke, and this equates to around 1 million people in the country. Slightly higher proportion of men, almost 23%, compared with just over 20% of women. And of these people, 1 in half of these people will die. 1 in 2 of these people will die from tobacco related. So it's a huge public health issue. And smoking leads to high levels of morbidity or levels of unhealthiness. And it's a leading cause of preventable death in the country. And it's at a higher level in poorer communities. So we can see that it causes, is directly related to causes of cancer, circulatory diseases, respiratory problems, and digestive problems. So across a whole range of morbidity problems and problems. And almost double the rate in the most disadvantaged 1/5 of the population as compared to the rest. Interestingly, children themselves have quite high levels of tobacco consumption. And in Ireland, we have rates of 12% of children aged between 11 and 17 are regarded as smoking on a regular basis. Smoking among women are again higher, is again recorded as higher in poorer communities. And in this cohort, approximately 56% of women are regarded as smoking or recorded as smoking. So it's a really huge problem in our poorer community. And then we come to secondhand smoke, which was really a big part of the focus of this presentation. And exposure to secondhand smoke increases the risk of serious medical conditions. And this is not often understood, that just being in the presence of smoking can lead to significantly higher risks of lung cancer, cardiovascular disease, respiratory disease, sudden infant death syndrome, and symptoms of nicotine dependence in the children of smoking. So people in and around smokers can also be very significantly affected by secondhand smoke. And that doesn't often get the coverage it probably requires. So people become initiated through a number of into smoking through a number of methods, but we know that it's typically happens to people at a quite young age. Most people, the vast majority of people indeed, begin to smoke before the age of 19. And again, having a parent who smokes and exposure to their nicotine dependence is a critical factor influencing intergenerational transmission of smoke. The studies have shown that having a parent who smokes is very much a key determinant of smoking initiation. But again, there is overwhelming evidence through vast number of studies that smoke-free policies have been shown to protect people from secondhand smoke. And with consequential reductions in mortality going from that. So we know from empirical evidence that if we have smoke-free policies, there will be a reduction in secondhand smoke and there will be an improvement in public health. And crucial to that is the denormalization of smoke. What's often not understood is the huge effect of tobacco-related litter in the environment. And in many studies, cigarette butt litter is shown to be the world's greatest environmental litter problem. Because it is so common and widespread, and for instance, cigarette butts are the most commonly found pieces of trash found in the oceans. And in our own situation in North Dublin, in 2008, we carried out an audit and we found that cigarette-related waste, the paraphernalia related to cigarette consumption, formed almost half of the overall litter. It's litter you find in the environment, in streets and parks and in hedges and around the general public realm. So half of the litter was to do with cigarette usage. So what effect has this tobacco-related litter? Well, cigarette butts do not easily biodegrade. It can take, in fact, 10 to 15 years to break down in the environment. People think they're just dissolve and they sort of go into become compost, but they actually take a very long time to decompose. And in that time, they will leach toxic chemicals into the water and soil in the environment. And children will experiment with littered butts and copy their parents or copy adults. They can also be eaten by birds or fish, and they can have a direct effect on causing fires in the environment. So against this background, we decided to pilot the smoke-free playground in Fingal. And it was regarded, if successful, Fingal County Council would adopt a smoke-free playground policy for 50 playgrounds under its remit, under its control. Now, people have, tried to ban cigarette smoking in different authorities around the country. But this was the first one that would be led by through a defined policy and through a research-based policy. And the specific aims of the initiative is to denormalize smoking in an area used by children, to reduce smoking initiation in young people, and to reduce the risk of secondhand smoke to non-smokers, thus decreasing pollution due to cigarette butts. So we were careful in where we chose the pilot location. We chose Blanchardstown in the west of our county, which itself has a population in excess of 100,000, and it has the youngest population profile of any part of the country, with 26% of the population there under the age of 16, 15 years or lower. So it has a very diverse ethnic profile, with 23, almost quarter of the population there are non-Irish nationals, and quite high levels of poverty in some parts of it. And in March 2010, the Millennium Park Playground in Blanchardstown was chosen as the site for the initiative because of the size of the playground. Is very large and it's very heavily used, and the fact that it's very heavily managed by the local authority. So we have park rangers present in the park at all times. So we could monitor and assist the program and do a certain amount of research directly with our staff. So the methodology we used in terms of getting the information in support of the idea was, we started with an attitudinal study, and we had arranged it. We involved people in questionnaires related to support for smoke-free playground initiatives, and then we did measurements of the particulate pollution to gauge the levels of secondhand smoke that actually people were being exposed to. And we surveyed the litter related to cigarette and tobacco in the playgrounds. And we did an intensive program over 1 week, and we trained our staff along with the healthcare professionals to actually do the survey. It was a very useful program for our own staff and inducting them into understanding what this pilot program was. And these measurements, as I say, these first measurements taken in August of 2010 over the period of 1 week, they formed the baseline information against which we could test the effectiveness of a ban or smoking on the playground, or we could determine what the baseline attitudes were indeed to smoking. So there were some key findings. We found that high proportion of people using the playground, much higher than the national average, 34% of adults were smokers. And half the smokers were typically smoking in the playground. Not all of them, but quite a high proportion were prepared to smoke in the playgrounds with the children playing. and only 17% of them disposed of their cigarettes butts in the bin provided. So this was indeed why we were observing the high levels of smoke-related litter. And then we looked at awareness of the dangers of secondhand smoke and smoke-free legislation as it exists in Ireland. And 75% were aware of the people we surveyed were aware that secondhand smoke causes serious illnesses like cancer. And 15% were aware that secondhand smoke causes some health problems. So, but almost all, 98%, were aware that some laws banning smoking in public places exist. And there's quite a high level of awareness in Ireland, because in 2004 in this country, smoking in enclosed workplaces became illegal. So it became illegal to smoke in offices, shops, factories, bars, etc. And within 1 year of that introduction, over 90% of people were complying, and businesses were complying with smoke-free legislation. And it's regarded by the vast majority of people in the country as being a success and generally a good thing for society. And there's high levels of compliance, as I say. So then, looking at the attitudes to smoke-free policies, 87% of people surveyed were in favour of reducing secondhand smoke exposure in the playground. And 77% were in favour of, indeed, a complete ban on smoking. That's just from within the playgrounds. That's from the Standing Start. So there was a reasonable level of support, general support for a smoke-free playground. So looking at the way we measured secondhand smoke, we wanted to have some indication of the level of exposure in the playgrounds. And levels of secondhand smoke are typically measured in PM 2.5 and PM 10 measurements. PM stands for particulate matter, and PM 2.5 measures air pollution with a diameter of 2.5 micrometers or less, which are small enough. These are particles small enough to enter even the smallest airways. And these particulates are known to cause inflammatory responses in the body's respiratory tract, associated with a lot of breathing difficulty. And PM10, as you'd imagine, the particles are coarser, dust-like pollutants, but they also cause respiratory and cardiovascular problems typically. And these two measurements are the way secondhand smoke is measured. Then looking at cigarette butt litter, we found that there were very, very high numbers of cigarette butts around park benches in the playground. Extremely high numbers. And this was in spite of the fact that we had daily cleanups in the playgrounds. But after a day's play, particularly on weekends, as you can imagine, were very, very high accumulations, indicating what we had seen, that people stayed for quite an extensive period and smoked quite a lot in the playground. So we were encountering large numbers of cigarette butts, and we were able to quantify these quite extensively. So the high levels of support for the initiative encouraged us to proceed with the initiative. As I say, there was enough for us to say, well, if we introduce a smoking ban, the majority of right-thinking people or reasonable people will probably support this, and we won't be fighting an uphill battle that people don't want to engage with or want to support. So we felt that the pilot project with the playground there going smoke-free for a period of time would be useful, would be work. So we wanted to do a bit of PR on it, and we got local schools involved. We'd had a lot of discussions with schools about the whole idea, and we invited them then to design a smoke-free playground poster in early 2011, on the understanding that the winning poster would be displayed permanently at the entrance to the playground, and that we'd have a media event and prize giving for the successful designer in March 2000. And this is our winning poster, a very strong emphasis on children's health, and I suppose the whole idea of respecting the area for children's play by not smoking. That was very strongly to the fore in this, and we've adopted this as our poster for all of it. So the Smoke-Free Playground pilot went live in May 2011. So that's when it kicked off. On foot of we went and spoke to the local representatives, made a presentation in the council chamber to explain that the playground would be off limits for smoking from May 27th, and we introduced it on World No Smoking Day with a lot of razzmatazz and all the kids getting T-shirts and a lot of photographs and selfies and all the rest of it taken. So it was very it was a good event. So then we did repeat measurements after the summer when which is obviously the busy time for playground usage, and we repeated the attitudinal survey. We repeated the secondhand smoke measurements to see if we'd had any effect, and we repeated the litter survey as well. And we can see the difference pre-pilot and post-pilot in the various measurements. We can see that post-pilot support for the initiative actually went up. So we surveyed the cohort using the playground, and there was a significant improvement in support, so a significant increase for that support. So you bringing it to people's, understanding and presenting them with the hypothesis that there shouldn't be smoking in the playground seemed to get buy-in from quite a lot of people once they saw it in action. This was very encouraging that we saw this post-pilot buy-in. And then the numbers of people smoking in the playground, it's a policy that we didn't have a bylaw underpinning it or any sanction. So it was for people to sort of buy in, voluntarily. But we saw that there was a very big reduction in people smoking in the playground. So it went down from almost 50% of smokers to only 20% of smokers. So that again was a significant result or a significant change in behaviour. And looking at the number of, the amount of litter that was generated by smoking, we saw there was a huge reduction. So even the smokers that were smoking were either smoking less or actually disposing of their cigarette butts properly in the bins provided. So that was another real benefit of the project. The playgrounds were cleaner and more suitable for use by children. And then looking at our measurements of secondhand smoke, we can see that, even in an open area, like a playground, you see that the exposure to secondhand smoke with its, there's no safe exposure to secondhand smoke. Any even quite modest amounts of it can be detrimental to your health. So we could demonstrate that even in an open area that's exposed to breezes and wind and that, just in the open air, there was a very measurable reduction in secondhand smoke in PM 2.5 and in PM 10, a very, very significant reduction from pre-pilot to post-pilot. So we had empirical information that we could use in terms of proposing, supporting the hypothesis that taking smoking out of playgrounds would improve the air quality, would improve litter levels, it would improve, and even you would get people to support it once it was introduced. So on foot of our analysis, pre-pilot and post-pilot, I presented a report of the findings to our Strategic Policy Committee. The Strategic Policy Committee is a group formed of local representatives, a small number of local representatives, numbers of individuals representing different organisations who have input into public policy in Fingal. And I presented a report in April 2012 outlining the findings that I've just shown you and indicating that we had good evidence of the benefits of introducing such a policy. And that, with the agreement of the Strategic Policy Committee, we put the proposal for smoke-free playgrounds for the entire county on display for public consultation over the course of an 8-week period. And we got very, the vast majority of people making submissions, again, were in support. Very small number of people with a negative position on it. And we brought that back. We brought the findings of these submissions from the public during that public consultation. We brought that back to the full county council in July 2012. And the policy was adopted as an actual policy for the county council in July 2012. The councillors voted in favour of it, having seen, number one, the evidence, number two, the support coming through from the public consultation process. So, to our mind, it was worth going through all of the logical steps, assembling all the information, so that we had a very robust position in relation to adopting this policy. So people couldn't say, well, that's your view, it's not the general public's view. We were able to show that there was general support and there would be general and also very specific benefits to introducing such a policy. So in similar situations with the other public health initiatives, it's important to line up the facts, even if it takes an extended period, because that makes it, it gives you something to fall back on. You can support your hypothesis then into the future. And that has proven to be the case with this policy. So on the introduction, there was quite a ballyhoo about it in the media. We got, I was involved in doing quite a number of interviews on it, and there was a little bit of even international coverage because Fingal was the first to actually go through this process of introducing the ban or introducing the initiative across our public playgrounds. And a lot of local authorities were able to follow suit, having reference and having regard to what we had done in Fingal. Now, a huge benefit of the process also was that the actual policy that introduced in Fingal then influenced an action plan, a tobacco-free action plan for the entire country, and it was inserted into a policy action in the national plan to further develop tobacco-free playgrounds initiatives in conjunction with local authorities by way of voluntary measures or by way of the introduction of bylaws. And I want to talk a little bit about that, the whole bylaw. So once we knew we had buy-in in terms of a policy agenda, it gave me confidence to go then and seek changes to bylaws. And bylaws are different than policy. Policies don't necessarily have a sanction. It can be voluntary issue that the county council or the local authority believes that people should not smoke in playgrounds and requires that they don't. But bylaws are something different, and as part of a longer process, I've been developing an open space strategy for the county. We're keeping it green, and we've, along with a whole raft of other measures, the development of recreational hubs, the development of large areas of farmlands, that sort of thing, different, more sustainable management regimes. We've revised the parks bylaws, incorporating incorporating smoke-free playgrounds as one of about a dozen new bylaws for the law. So that's in the process of being adopted at the moment, and that will become a bylaw this year, I expect. So I've recently brought these bylaw changes to our strategic policy committee, and they'll be on display throughout the summer, and then we'll bring the smoke-free playgrounds back as a bylaw for adoption, as well as being a policy in the autumn of this year. And this is the new bylaw, that no person shall in any public playgrounds engage in smoking tobacco or tobacco-related products. And again, there's a lot of, I suppose, there's a lot of contention over the wording here. We feel that including tobacco-related products would deal with vaping, because in a lot of studies it's been shown that vaping can be a gateway or an introduction into smoking, and it has the effect of normalizing smoking in public areas. So no doubt there'll be quite a lot of submissions on that over the course of the public consultation or the new bylaw. So the whole idea of smoke-free playgrounds fits within an overall national framework, the Healthy Ireland national framework, for actions to improve the health and well-being of the population. And themes in this framework include good governance and policy, partnership and cross-sectoral work, empowering people and communities, and robust research and evidence. And our smoke-free playground initiative ticks all of these boxes and is aligned with all of these themes for this national framework. And we feel, as leaders in public open space and local government, we need to be at the forefront of improving public health. Public health was the original and continues to be the bedrock, I suppose, rationale or reasoning underpinning the provision of public open space and parks. All the original legislation dating from the 1800s required the provision of public open space for public health reasons, not, as opposed to any other or esoteric or sort of amenity related general purpose requirements. So that public health underpinning is really important to be in that space and to demonstrate that we as providers of public space have that to the forefront, and the smoke-free playground fits with it. So just to finish with a few conclusions, and just to say that open space related policies can contribute to public health benefits, and smoke-free policies like the smoke-free playground protect people from secondhand smoke. This is really important. It's protecting secondhand smoke, and ultimately reduce mortality and effects, very serious and deleterious effects on people's health. And they help to denormalize smoking. So that's the end of my presentation, and I'd like to pass you back to Monica, and thank you for your attention.
Thank you very much, Kevin Halpenny, Senior Parks Specialist at the Fingal County, Dublin. 1 CEU is 0.1 CEU is available for this presentation. A total of 3 CEUs are required to maintain CPP or CIPP certification in a 3-year period. To receive your 0.1 CEU for participating today, you must answer a brief assessment, pay a $15 processing fee, and we will send everyone who registered a link to the assessment and the fee. You must register in order to receive CEUs. Again, thank you, Kevin Halpenny, and this is the end of this presentation. Thank you very much. Okay, Kevin, I think we've got it. That one was, the sound was way better.
Was it? Yeah.
So I think we're very good.
Okay. Yeah, probably.
So I will get Matt to make it so that you can see the presentation. We'll put it up on the website this afternoon sometime, but I'll send you a copy of it.
Yeah, appreciate that, Monica. I'll check into that registration again. There's something funny about that, but I'm glad you were able to hear me this time, and hopefully the recording went better this time. And thanks for your help with that.
Yeah. Thank you. And I'll be in touch, and I'll send you the recording. I'll test it out to make sure you can get into it without the registration.
Oh, okay. Well, listen, thanks, Monica. Thanks for all your help.
Okay, thank you.
Good working with you.
Really good to hear a Dublin accent again.
Good working with you. Likewise. All the best.
Okay,
all the best. Bye now. Bye-bye.